Every year, more than 600 patients at San Francisco General Hospital and Trauma Center are identified to have severe sepsis. Despite the best efforts of physicians and staff, some of them will not make it. Before we started our task force, I'd say that our care was sort of not coordinated.
We didn't have a lot of standardized knowledge with managing these patients.
We didn't have any sepsis protocol or guideline in treating a septic patient.
In 2010, our mortality rate exceeded 20%, which we felt was unacceptably high.
We collect data on an ongoing basis about patients with severe sepsis and septic shock. So we're constantly reviewing that for outcomes, how we're doing with mortality, and how we're doing in meeting our goals, specifically for the sepsis bundle.
And today we have a very robust system of measuring our data and reporting it out to all the people who need to know it. And one of the early things we learned actually had to do with fluids. Giving fluids early and aggressively is really key to successful sepsis treatment.
Really kind of highlighted the fact that we really don't know how fluid boluses are defined in our institution.
We created a standard where orders for fluid boluses had to include the time over which the fluids would be administered.
We have a sepsis order set whereby opening an order and clicking a single box, we can order all of those necessary first steps.
So we have screening tools that are available in the emergency department, in all of our inpatient units, and in some of our outpatient clinics as well. The pocket cards were a tool that we devised early on in our work.
A really nice kind of visual aid that can just fit right in your pocket, that you can look at to remind yourself both of the criteria for sepsis and then the recommended treatments and the timing in which recommended treatments are administered.
Education has been a really key part of our sepsis program from the start.
So we've done a huge educational outreach in the ED, the ICU, housewide, to all the different services.
Through education and training, nurses are more proficient in screening and in the management of sepsis.
Well, I think that we've made really remarkable strides in 4 or 5 years. Our mortality rate has dropped by more than 50%, and it continues to remain low. So that's probably the #1 thing that we're proud of.
It seems like, it takes a long time for change to happen. And now seeing that change happens is really great.
What this means to patients is that when they come to San Francisco General Hospital and they have an infection, they can have a reasonable expectation that they're going to do well when they come to our hospital. They're going to get coordinated, timely, effective care that's based on the evidence that we have available to us right now.
A patient coming to SFGH can expect to get a very team approach to the management of sepsis.
They can come to our hospital knowing that they are going to get the best care available.